Hi, everyone. It's Jean Sachs. I'm the CEO of Living Beyond Breast Cancer, and I hope everyone is feeling well and staying safe and taking good care of yourselves during these really difficult times. I am here this evening to talk about Living Beyond Breast Cancer's conference on metastatic breast cancer. This is a program we have been offering. It would have been our 15th year. It's always been in person. And it's always been an amazing weekend of bringing together women and men and their families and caregivers to talk about issues that face the metastatic community. We bring together top healthcare professionals, and there's so much networking and community. So when this COVID-19 pandemic started, we realized we couldn't bring people together. It was supposed to be held on, I believe it was April 17th. In Philadelphia, and we knew this population of women and men living with metastatic breast cancer were not going to be able to travel. So we quickly began to make plans to bring the conference virtually, and we will be holding it the weekend of June 13th and 14th. And we've put together I think a really wonderful program, and a lot of that is because of an amazing advisory committee that joined us this year to make sure that we were addressing all the issues and approaching all the content in the most appropriate way for the metastatic breast cancer community. So tonight, I actually have 3 members of the committee that are going to talk to you as well and tell you what to expect. Unfortunately, one of the members, Chawnte, was unable to join us this evening, but we thank her for all her work. So this group of women have not only were meeting with us for months prior to the pandemic and had a wonderful conference planned, but then had to pivot with us to figure out how to make this as strong as we move to the virtual format. So we're so thankful to all of them. And so tonight I'm joined by Ruth and Sheila and Abigail. And I'm so glad that you're with us tonight. So I'd love each of you to introduce yourself, tell us how you're doing, and also where you're from. I'm going to start with Ruth.
I'm doing fine, thank you, and I'm happy about that. And I live in Abington Township in Pennsylvania.
Well, I'm glad you're doing well. And how about you, Sheila?
Hi, I'm Sheila, and I am from Swansea, Illinois, by way of Cleveland, Ohio, and I'm doing great.
Yay. And Abigail, how about you?
I am so happy that the pools are open now. We are in Miami, Florida, and we've been waiting for that. So being able to soak in the pool has been great.
Oh, that's great. I'm sure your kids are happy, and
yes,
that makes life better. So all of you are living with metastatic breast cancer. And as we know, it is just because you have the same diagnosis, we know everybody has their own experience and their own unique perspective. Ruth was diagnosed in 2018, Abigail in 2017, and Sheila in 2009, which is just incredible and will be so reassuring to all the people coming to the conference for the first time who are more newly diagnosed. I encourage everyone to look at our website, look at metsconf.lbbc.org, and you can read the full bios on these wonderful women and learn more about their journey. All of you have been to the conference before except for Ruth, so you know what it's like to be there in person. So I'm going to start by asking Abigail to just say in a few words, what does this conference mean to you?
I attended the Metastatic Conference for the first time last year, and I was part of the Hear My Voice advocacy class. And even though I've been involved in advocacy since I was diagnosed, I had never been in a room with that many other people living with metastatic breast cancer. It was overwhelmingly positive that here are all these other people living their lives the same way that I was, and they had just so many ideas, and I just had such a great time meeting people, especially in our Hear My Voice class. So the content was great last year. I'm really looking forward to the content this year, although I have to say I'm a little sad not to be able to hug all those people again in person.
So as a first-time attendee, were you nervous coming? What were your feelings as you got off the plane and started the weekend?
So I've been a lawyer for a long time, and all of the legal conferences I went to were gigantic like that. So it wasn't as much of a nervousness about it being a large group of people. It was more, as an introvert, I wasn't sure that I was going to connect very much with the person I was sharing a room with. I think that was probably the thing that was the most daunting last year, but we had a great time.
That's great. Well, this year, nobody has to share a room.
Exactly.
So Sheila, you've been to many Living Beyond Breast Cancer conferences and have done many things with us. So tell us what the conference is like for you and why it's meaningful.
Well, I started going to Living Beyond Breast Cancer conferences back in 2013. I think my first one was in Seattle, and I learned about Living Beyond Breast Cancer on the internet. And I'm like, what's this Living Beyond Breast Cancer? So I went, and it's just exhilarating. It was so much compassion and love. And the conference I went to was all stages. So, but the women there, they accept, I'm like, man, I'm stage 4 and, they're not going to accept me, but they accepted me for who I was. And, they didn't care what stage I was. It was just love. And from the LBBC staff to just pure love and concern and resources. And we're here for you, and helpline resources. And I was part of the Young Women's Initiative program, and that literally started my advocacy program, because I was like, man, there are people out there that really care about me. And I'm not just saying this because I love Living Beyond Breast Cancer, but it was just exhilarating just to find that people, there are people like me. There are, African-American women that have metastatic breast cancer, and the connections. I think it was more of the connections for me to just have someone that gets you, like they get me when I want to cry or whatever, because metastatic breast cancer. But yeah, it was just such an amazing, amazing experience. And I look forward to it every year.
Yay. So I know both of you, because you were on the committee this year, you worked on all the details, but at Living Beyond Breast Cancer, we always want to make sure the content is really strong. From the healthcare professionals and the medical information, and also balance that with community. So just quickly, what's most important to you? Is it getting the medical information, or is it getting the connection? Maybe Abigail, what do you think?
It's definitely the connection. I'm not discounting the value of the amazing speakers that are coming to talk about the medical pieces, but it's really everybody in the same room who gets it, just like Sheila was saying. That is the amazing part of it. The other stuff's great too, and I'm going to be helping with the medical marijuana panel, so I'm excited about that.
That's great, and we'll make it feel connected even though you're all virtual. So I want to pull Ruth into the conversation, because this will be her first conference. So tell me, what are you most looking forward to?
Well, it's been a pleasure meeting these ladies, because the panel's the first individuals that I've conversed with about this disease. And so for me, it's sheer enlightenment entering, and it was really a pleasure working with the advisory with Sharon and her staff, and very thorough. I've been on other conferences, but not quite like this, and looking forward to it. And I'm in all of the other 3 ladies that are in the panel. I think it's my pleasure to be interacting with them. And I love to interact with people. So
Right.
That's another plus for me.
Yeah, and we're all missing that. How about you, Sheila? What are you looking forward to the most?
Back in 2000, when I first attended my conference, actually I found out about Kadcyla, and I went back to my doctor, and I'm like, because I started progressing again. Ironically, I was at the conference, and I said, well, what's up with this Kadcyla? And she put me on it, and for 5 years I went stable. So I learned about Kadcyla at the conference. So I think it's both for me, the connections to be able to share my advocacy and my love and support for everyone, to make, especially to let them know that they're not alone. There are women out there that love them too, but also the medical side of it. Because, you know, I really just want to learn about the disease because my mom died of it in 2004.
Right. And, you know, you've been battling this since
Yeah.
2009. So you've obviously had a lot, you know, several treatment changes along the way. So you
Yes.
certainly know the value of, you know, really being educated and being your own advocate to say, hey,
Yeah.
what about Kadcyla, or what about this next drug? Yeah. So just to recap, because we really want to, you know, we always want new people to come to this conference. And I know sometimes, you know, it's a little overwhelming to come to a physical program, but then even to say it's a weekend in June, do I really want to take the time to sit in front of a computer? But I think what you're all saying is it's so worth it to get the information. There will be live sessions, so you'll be able to actually ask your questions, and then you can watch things later, but being there in real time and we'll have chat rooms and ways for people to connect. So the staff has worked really hard along with your advice to make this a really meaningful weekend. So again, thank you so much for all of your efforts. And we encourage everybody who's listening, if you haven't already, to go on to metsconf.lbbc.org and register. If you know anyone who was recently diagnosed or has been living with metastatic breast cancer and they may not know about this, please let them know. And thank you so much for your time this evening. And everybody, as I end all my interviews, stay safe, stay well, stay strong, and we will see you on June 13th.